Welcome to Healthcare Videos, and this week we have a whole week of information planned for you to support your brain. You can't live without a really highly functional brain, and we're going to be giving you all of the information that you need in order to keep your brain in the best shape possible. There are so many different aspects with regard to how our brains are functioning that give us the indication that maybe we need a little bit of support, we need a little bit of balance. So it could be that you're dealing with anxiety or depression. Maybe there's a little bit of memory loss. Maybe it's progressed beyond a little bit of memory loss. Maybe it's dementia. So many different possible diagnoses. So Dr. Slavin, when people come into your office to see you, they say, "Doctor, I'm feeling a little tense," or "Doctor, I can't remember where I put my keys." Do you have a lot of patients who are talking to you about dissatisfaction with how their brains are working?
Well, that's a complicated topic, but it's one of the most feared conditions that people consider is Alzheimer's disease. Because you've seen people who develop Alzheimer's disease and they're just completely out of touch with their environment, and they don't recognize their loved ones, and that's probably more scary. You know, living like that is more scary than dying from heart disease and cancer, which are the other things that people are concerned about.
Which is something like anxiety, the most commonly treated brain anomaly in the United States.
Anxiety you're talking about?
Anxiety and anxiety prescriptions are the most written prescriptions. So things like Xanax and Klonopin, Valium, Paxil, Ativan is an anti-anxiety choice.
Yeah, but you mentioned an antidepressant. A lot of doctors will throw that into the mix as well.
And there seems to be a little bit of crossover, anxiety and depression. Like if you're continuously, overwhelmingly anxious, that would be pretty depressing.
But this highlights part of the problem with healthcare in this country, and this is the hoax, part of the hoax we're talking about, is that when you go to the doctor with anxiety, he gives you a Band-Aid for it with a drug instead of exploring the underlying cause for the anxiety. So you go, you say, "Oh, I'm feeling anxious, I'm tense, I can't sleep, I'm nervous." Well, take this drug. But what about all the underlying reasons for those problems? Totally ignored.
And we're going to get to that day by day. The second video in the series would have to do with the causes for why people might be dealing with anxiety, might be dealing with depression. So there are 4 billion with a B prescriptions every year in the United States for antidepressants, and in the
multiply that by at least $100, it's a big moneymaker. And you begin to understand why this is the approach that's taken.
In the UK, 61 million prescriptions a year. Cymbalta, Zoloft, Prozac, Lexapro, Paxil. And then when you start to talk about the potential for developing dementia, very interesting that it's possible when you haven't gotten to the underlying cause of your anxiety, depression, poor memory, poor concentration, all of those brain issues, maybe you might be at greater risk for developing dementia. So right now they're saying that there are 47 million people globally dealing with a diagnosis of dementia. And by 2030, it's going to be 75 million. And hold on to your seat. By 2050, 132 million diagnoses of dementia. That is really scary
And
stuff.
that's just in this country.
No, this is
Worldwide?
globally. This is
Worldwide?
globally. Those figures were 47 million globally now, 2030, 75 million, 2050, 132 million. Now, what do you think might be an issue with all of that? I certainly think that there may very well be some environmental toxins, there might be lifestyle choices, there might be a whole lot of information that we'll be able to share with our viewers with regard to potentially developing any of these brain issues. And for our viewers, if you're using one of these prescriptions that I mentioned, either the antidepressant or the prescriptions for anxiety, we can share with you specific information about how to make changes in your nutrition status, how to make changes in your biochemistry that will minimize the possibility that you'll continue experiencing these brain issues.
And one other point, what does that say about the healthcare system when they're predicting such a large increase in the number of people experiencing these problems as far as their ability to treat people?
I think they might be counting the money. What do
Right,
you
it
think?
shows that the treatments are irrelevant as far as keeping people healthy. It's relevant as far as making a lot of money, because that's all they do is sell more and more drugs, but they're not addressing the problem, and as more and more people realize that's why we're seeing such a shift in the way people are acting, their behavior, is they're beginning to learn, in a large part because the information is available on the internet. Before, people had a very difficult time getting this information. They used to only depend on their doctors, and now they can get this information outside their doctors. And the first thing that should come to mind is the drugs aren't correcting the problem; it's just covering it up. One quick aside right now about dementia that I've talked about on the radio before, and that was with Chris Christopherson.
Very interesting
Just to give you an idea,
information.
because
Yes.
when someone has dementia, meaning their memory they're losing their memory, they can't think of words, things
They're
like
not
that.
functional. They're not able to go about their routines in a productive way.
So the doctors give you a label and they say, well, take this drug. They know that the drug probably doesn't work, but they have to offer something to the patient. Anyway, that was the case with Chris Christopherson, until he met another doctor who said, let me check you for Lyme disease. And he checked out positive, and they started treating his Lyme disease, and his memory started coming back. So it just gives you a thought about there are a lot of causes of dementia, and you can't just lump everybody into Alzheimer's and say there's no treatment. Another common cause is vitamin B12 deficiency. How many people are looking for that as a cause of dementia? And then another cause is vascular dementia. That's why chelation therapy has been so effective in improving people's mental status. So you're not being told about this by mainstream medicine, and that's part of the hoax we're talking about.
There are so many different support therapies. There are so many different suggestions for changes in your diet, in your lifestyle. There's information about supporting your brain function with exercise, and that the statistics show people who exercise regularly have a reduced risk of developing memory problems and ultimately dementia. So for today, that will be our introduction to this week's topic, which is all about your brain. Thanks for watching. See you tomorrow.